My name is Dr. Margherite Matteis. I'm an associate professor in psychiatric nursing at Regis College in Weston, Massachusetts. Regis College is a small Catholic college with a very large nursing program, 15 miles west of Boston. And the title of my presentation is Integrating the Internet to Think Family and in Graduate Nursing Education. My background is in research, education, and practice in family therapy. Presently, a lot of the focus of my work is on nursing education and nursing research. I teach our family systems theory course at Regis College. It's a graduate course that's required for our psychiatric NPs, geriatric NP, family NP, and pediatric NP students. As we know, there's a theory-practice gap in nursing. And in consultation with two of our senior NP faculty, I revised the course. It was basically a family therapy course and family theory course into integrating the clinical role of the family systems advanced practice nurse as its foundation. So that has been a major undertaking and been very fruitful. An important part of this is I integrated the internet in helping my graduate nursing students, if I may use the term, think family. And I'm going to go over two internet resources I used and how I integrated them into the course. The one focus I had was instruction and application in the Calgary Family Assessment Model and the Calgary Family Intervention Model. And I used the movie, an old movie, some of you may know of it, some of you may not, on Golden Pond. I used that movie, excerpts, to help the students to think family. And the focus of the movie is on family relationships in late adulthood. And the central character has a decline in cognitive functioning, and we would think he has dementia. The excerpt from YouTube that I use is Henry Fonda, who's the main character, gets lost going home from the pond and speaks to his wife about the incident. And she is supportive of him. And he's very frightened. What I have the students do, first I present the Calgary Family Assessment Model and Intervention Model. Then I have one of the students, they put the genogram of the family on the board. We view the part of the movie together, and then the students break up into groups and use reflexive questions and how they would interview the family. Here, in the case, the husband and the wife, looking at the domains of cognitive, behavioral, and affective questions. And this works very well. The students enjoy it and has them start to think family and think family in terms of assessment. Another example that I use is to focus on illness narratives. And what I use for illness narratives is have the students in their home as an assignment listen to the podcast from National Public Radio, NPR, on an excerpt from an interview, or they could listen to the whole interview. For the book, the person is being reviewed who wrote the book. The name of the book is Life in Balance, a physician's memoir of life, love, and loss with Parkinson's disease and dementia. And it's this physician, a Harvard cardiologist, Dr. Thomas Grayboy's experience of living with Lewy body's dementia. And Lewy body's dementia is a neurodegenerative disease which includes Parkinson's disease, dementia, and including with that psychotic symptoms. So he is interviewed about what his life is like. Also, the students then sometimes read the book on their own. After they have that experience at home, at their leisure, and they have a reading on narrative therapy and an article that applies the narrative therapy model, they come to class and we use this for learning and discussion. One of the students puts the genogram on the board with focusing on relationship lines in the family, and the students break up into groups and help the family, as if they were the family advanced practice nurse, develop illness narratives. And then they present them to the class. And it's a whole more than affective experience in doing that. So they work on for counseling the families until their illness story. So these are the two prime examples I wanted to present. I've also used other websites from the Veterans Administration. They have little vignettes on families coping with their loved ones coming home from the war. They're very moving. I also have used YouTube movies. Here's another dated movie, but some of you may know of it. Ordinary People, which is a family experienced the traumatic loss of an adolescent through an accident. And I've used that for students to learn about family communications, traumatic loss, and stress. All of these also can be converted to online classes, and which I have used online classes with this modality too. What I'd say that it helps the students put family in the spotlight, their role in terms of family, and also some of the little anecdotal evaluations students have written in their evaluations anonymously was that it helped them learn the material better. Also, they've come back to the classroom and talked about how they've used the role with their patients in their own clinical area. A lot of them are working in the clinical area. So I just want to summarize some of the work I've done with my students to help them think family. So thank you for your time and attention.